Cataracts are diagnosed through an examination on a microscope called a slit lamp. Your specialist will have a look at your eyes, often with dilating drops instilled so that your pupil is made larger and your lens can be viewed. A cataract would appear to your examiner as a mistiness or cloudiness of the lens in the eye. They would also check the rest of your eye to make sure there are no other problems explaining your symptoms. At present, surgery is the only treatment available for cataract. There are studies ongoing as to whether there may be other treatments in the form of drops to reverse the signs of cataract. However, at present, there is nothing licensed nor proven to work. From your clinic visit, measurements will be taken of the eyes in the form of a test called biometry. This will inform us as to what power lens to implant within the eye to give you the best vision possible. A discussion will happen with your surgeon whereby you'll decide what type of vision you're aiming for, whether it be distance, near vision, or a blend with some of the more premium lenses. Once you've selected your preferred refractive or lens option, surgery happens as a day case procedure. This is most commonly done with a local anaesthetic. Drops are put in to numb the eye, and often a pellet or drops are put in the eye to dilate your pupil. During the surgery, you may feel the occasional pressure. Sometimes you feel hands resting around your face, and you may see some lights and colors, but the experience is designed to make sure that you're comfortable throughout. We always have an option of topping up anesthetic if you do feel uncomfortable at all during surgery. Some people do find that sedation or even a general anesthetic is helpful, especially if they feel especially nervous or claustrophobic, for example. After the surgery, drops are given for a period of usually up to about 4 weeks, and that's to help the eye settle and prevent infection. After surgery, you will usually go home with a clear plastic shield over your eye. Your vision will be initially a little blurry, but this will gradually settle over the 24 to 48 hours after the surgery, and you may experience some improvement over the first week or so. You may find that the eye is a little bit irritated, akin to having a hair or a grain of sand in the eye on and off over the first few days, but most patients will remark that this is not troublesome. Drops are given for you to take home, and these are used usually 4 times a day in the initial period. These drops continue for a period of up to about 4 weeks. Most patients remark that they experience excellent vision within 24 hours after their cataract surgery.